All right, thank you, Kate. And now it's time to answer some common medical questions. And joining us now is News Channel 5's medical expert, Dr. David Soria. He is the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you so much for coming in today.
Good to see you, Keely.
You're snazzy as always.
Thank you.
All right, this is the time of year when a lot of folks indulge in quite a bit of eggnog and a few other adult beverages. So we certainly need the answer to this question. Does drinking water help stop a hangover, or is that just a myth?
Yeah, we all want to know the answer to this one, and unfortunately, I probably am not going to give you the answer you're looking for because we've heard of dozens of them, right? I mean, we all probably have our own little home concoction. The reality is the only real cure is time. However, some of them do work to make you feel better. Like we've heard about the hair of the dog, right? Drinking, the following day does not work, only delays your hangover. You've heard about drinking lots of coffee. Doesn't work, doesn't do a thing. You probably also heard taking aspirin or Tylenol beforehand maybe will mitigate some of the symptoms the following day. Matter of fact, that's the last thing I want you to do. There was actually a study that showed that if you take an aspirin before you drink, it can actually increase your alcohol level by 26%. So a significant no-no. So what can you do? Well, the reality is there's two things that will really help prior to or while you are drinking if you want to really indulge. One is have something in your stuff, have something substantial, have a burger, have some bread, something that can soak up the alcohol so that it slows the metabolism or slows the absorption of the alcohol. That's number one. And number two, just like we mentioned, water. Absolutely a help. Will rehydrate the body, and equally important, while you're drinking, have a glass of water and a drink, meaning maybe alternate or have them at the same time, but certainly diluting the amount of alcohol that you take in will definitely improve the symptoms the following day. I heard hangovers are tough. I don't know. I haven't had one.
I know you don't know anything about that, Dr. Soria. All right, it's flu season, so besides a flu shot, what are some other steps you can take to avoid getting the flu?
Yeah, well, the influenza vaccine is very important, and I want everybody, and I encourage everybody to get that. But keep in mind that the influenza vaccine only protects you against a couple types of influenza A and one of the influenza Bs and some of the viral variants that surround those viruses. Otherwise, there are hundreds of them that are out there that can cause flu-like syndromes and the common cold, and so the influenza vaccine is not going to protect you against that. So the easiest, best way to prevent it is by minimizing your exposure in the first place. So a couple things. One is avoid public surfaces, doorknobs, tabletops. Avoid them as much as you can. If you do make those contacts, then wash your hands or use alcohol-based gel. And then make sure that also you try to avoid touching your eyes, nose, or mouth, because that's where it's going to be transmitted. Make sure that if you do have a cold, you cough into a tissue or into the nape of your sleeve so that it doesn't get on your hands. And if you're sick, I want you to stay at home, minimize exposing anybody else. Try to stay home at least 24 hours after your fever is gone. And this way, everybody else out there can remain safe.
Good advice there.
All right.
Thank you, Dr. Soria. If you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com. Click on the health link, scroll down, and on the right-hand side, you'll see a form to write in your question. Thank you so much for coming. Always great to see you.
Good to see you, Pete.
We'll see you next week, and we'll see you after the break.